Do you frequently feel like your heart pains sometimes? Wait, actually, that might not be your heart. What if I told you some people bleed inside their joints and think it's just a stiff knee? That's what often happens with hemophilia A. Imagine getting a small cut and it just won't stop bleeding. Or waking up with a huge bruise but not remembering hitting yourself. This is life for someone with hemophilia A, a condition where your blood doesn't clot properly because the body is missing something called factor VIII. Without it, even a small injury can turn into a big problem. So the pain in the knee, likely a bleed inside. The weird bruise, probably another internal bleed. Your body is like a well-trained team, the blood cells, platelets, and clotting factors. But in hemophilia A, factor VIII is missing, so the team can't finish the job, stopping the bleed. So why does this happen? Let's play detective. Imagine you're born with a typo in your instruction manual, your DNA. This typo is passed from parent to child, usually from mom to son. Hemophilia A is caused by a mutation in the F8 gene. This gene is responsible for making factor VIII, the clotting hero we talked about. If the gene is broken, the body either makes too little or no factor VIII at all. Most boys with hemophilia A are born with it because the gene is on the X chromosome. Guys have one X and one Y, so if their X has the broken gene, they don't have a backup. Girls have two XS, so if one is broken, the other can often cover for it. That's why it mostly affects males. But here's the twist, not all cases are inherited. About 1/3 of cases happen due to a random mutation in the baby's genes, no family history at all. It's like a surprise plot twist in a movie. Now, how do you know if someone has hemophilia A? Let's pretend you're a doctor. You meet a 5-year-old boy who keeps crying after falling off his bike. But this time, his knee is swollen, warm, and stiff. No broken bone on the X-ray. Could it be a bleed? Yes, this is called a joint bleed, and it's super common in hemophilia A. Other signs include nosebleeds that last 10 minutes or more, bleeding gums after brushing teeth, heavy bleeding after shots or surgery. Sometimes there's blood in urine or poop. Even a simple dental visit can lead to non-stop bleeding. Kids might walk awkwardly to protect a hurting joint. In severe cases, bleeds can happen even without injury, called spontaneous bleeds. It's like your body's alarm system is broken. No injury, but the bleeding starts anyway. The worse the deficiency, the more frequent the bleeds. Okay, let's fix this. How do doctors diagnose it? Blood test. They check how fast the blood clots and measure how much factor VIII is in the blood. If levels are low, yep, hemophilia A. Now, treatment isn't a cure, but it works well. The main treatment is replacing the missing factor VIII through an IV drip. Think of it like refilling the broken gear in a machine. Some patients get it regularly, prophylaxis, to prevent bleeds. Others take it only when they bleed, on demand. There are also newer medicines, like emicizumab, a weekly or bi-weekly injection that helps blood clot even without factor VIII. It's like a clever shortcut. Physical therapy helps damaged joints. And first aid, rest, ice, compression, elevation for swelling. For nosebleeds, pinch nose, lean forward, sit down. Early treatment means less damage long-term. Can we stop hemophilia A before it starts? Well, we can't yet change genes at birth, but we can plan. If a family knows they carry the gene, genetic counseling is a big help. Think of it like a family meeting with a specialist who explains risks. Prenatal testing can check a baby before birth using amniocentesis or CVS. Parents can decide how to prepare. For those without family history, it's trickier, but newborns with abnormal bleeding should be tested early. Also, carriers like moms can get tested. And yes, in the future, gene therapy might allow prevention by fixing the gene early. But for now, prevention means awareness, testing, and planning, especially for families with a history. Exciting news, science is moving fast. Remember how patients used to need IV infusions every few days. Now, gene therapy is being tested in clinical trials. Imagine a one-time treatment that helps the body start making its own factor VIII. How doctors use a harmless virus to deliver a working F8 gene into the liver, the factory for factor VIII. Some patients in trials have had normal or near normal factor VIII levels for years. Another advance, longer-lasting factor VIII products, so fewer infusions. And emicizumab, already approved, is a game changer because it's injected under the skin, not into a vein. It's like upgrading from dial-up to high-speed internet for treatment. Scientists are also working on ways to stop inhibitors when the body attacks the treatment, as this affects about 30% of severe cases. The future, possibly a world where hemophilia A is managed with one shot a year or even cured.